Hi, my name's Dr. Amir Khan and I'm a GP at the Ridge Medical Practice in Bradford. If you're thinking about a career in general practice and want an idea of what you're letting yourself in for, then our peer-to-peer sessions offer a bit of insight. Each episode features genuine conversations between GPs and other practice colleagues. Dr. Sandy Khosla introduced the partners at his practice to the idea of employing an advanced nurse practitioner, Julia. They've been working together for years and have expanded the team even more since.
I'm Dr. Sandy Khosla. I'm a GP in Derby, qualified in 1997 and been a GP now for a good part of 23 years. I worked in a previous practice for 14 years, which is where I met Julia, who joined us as an advanced nurse practitioner for 4 years, I think.
Okay, so my name is Julia Taylor, and as Sandy said, I'm an advanced nurse. I've been working in general practice now for 18 years and met Sandy about 11 years ago when we started working together, and have been working at our current practice for around 6 years now. And yeah, it was a strange situation, wasn't it, Sandy? You had to do a bit of persuasion around these extra roles and advanced nurse practitioners. And I remember you asked me to come in and present to the partners one day about what skills I had and what I could do and what I couldn't do.
I mean, that's right, because it was a new concept to the practice I'd moved to. Previously at Charm, my previous practice, I'd worked with Julia and we had another ANP working there. And so you sort of built that experience and confidence in the person doing that role. When I moved to the new practice, they'd never had an ANP working there before. So it was a new concept to them. We were at a point where the workload was increasing. It was difficult to recruit doctors. And I introduced the concept of an ANP to the partners. It's true to say that it was something that they weren't familiar with. They had issues around safety and competency. And so they suggested that maybe we get Julia to come into the practice, introduce herself and do a presentation.
I think it was, like you say, it's when it's new, it is around really understanding the role. And I think it's quite challenging because there hasn't been huge amounts done in terms of capability. But now that's all coming in terms of establishing competency and capability for advanced practice. That's helpful going forward for employers. But yeah, as we started off, it was a case of really having to sort of market the idea really to the practice. But luckily they agreed, and I started working with the team, as I said, 6 years ago. And since that time, we've been recruiting more advanced nurse practitioners, and we've got a team of 4 now and another 2 about to start. So some are sort of fully trained, if you like, and others are in sort of trainee posts. So it's been an interesting journey, I think.
I think one of the beauty of general practice is that you can pretty much determine the sort of career path you want to take. It's not just always just doing GP and GP surgeries, but if you've got other areas of interest, general practice definitely gives you the opportunity to develop those skills. I've managed to develop my skills in ultrasound scanning and using the scanner to help inject joints. I've been given the opportunity to work for the local football club. It was last year, they had games in Europe. I was able to organise with my partners time out of the practice so I could fly abroad to practically just watch a game of football and then come back the next day, change my surgeries around and swap things around so I could make that happen. So my general working week is sort of 3 days a week in general practice, 2 sessions a week, doing the work at the football club. My sessions within the practice, I'm doing a couple of clinics a week doing MSK work. So there's a lot of variety and flexibility in my working week, which, as I say, just makes things a lot more sustainable.
Yeah, absolutely. There's always something new. I mean, there's always new sort of developments in terms of patient care and updates, that way. But as you said, Sandy, the fact that you can go off and work differently is massive. I know you really enjoy your MSK. And from my point of view, alongside my clinical work, I've got my GP program director role and some leadership roles around advanced practice, both regionally and nationally. So it's really nice to have, if you like, that little bit of a portfolio career, and it keeps your interest. There's lots to keep you going with.
We're all just constantly learning from each other, which I think is another advantage of having sort of a diverse group of people working within your practice.
I mean, it's changed massively, really. I mean, not saying that you're old or anything, Sandy, but, when you first qualified as a GP, nurses in general practice were doing very specific things. And now, as you said, we've got the practice nursing team, we've got a team of mental health nurses, we have the advanced nurse practitioners, and then all the other multi-professions coming in. So it is a very different environment to be working in these days.
I agree. I mean, the workload is certainly increasing. The problems we're seeing are a lot more complex. Time is a factor, and having a skill set that can meet demand. And I certainly find that, for example, having a mental health worker within the practice, having a pharmacy team with the practice, you can offload a lot of that workload to be fair, clinicians have got probably a little bit more time, are just as competent, if not better, at the GP in managing those problems, which then gives us time to manage sort of more the complex medical cases that we're good at.
I think just in terms of how we're working now, it's almost a way of working differently. So we've got a variety of people, a variety of clinicians that can care for the patients in slightly different ways according to their strengths. So, it's about sharing the workload, really. So hopefully that, as you say, it's a more sustainable model for everybody going forward.
I think examples of where AMP is working with the GPs and how they can support it is certainly one big area is the on-call. So the way things work in most practices is that once all the appointments have been taken for the day, anything that's regarded as urgent and can't wait till the following day is given to an on-call doctor. And this could be a variety of different things could go on that screen. It's so unpredictable. And on top of that, you may get late visits as well. So having somebody there to help the on-call doctor, it makes life so much easier and less stressful, particularly on difficult days like Mondays and Fridays. And certainly Julia has helped me on a number of occasions with the on-call where the lists are getting longer and longer, trying to get through and manage the patients. And Julia will go in and dip into the on-call and do sometimes an equal number of the callbacks that I'm doing.
I think that's been something that has been, quite a marked change for the practice since advanced nurses have come in. So in terms of working alongside the GP with the on-call list, we can have 60 callbacks sometimes on a Monday. And that you see the list growing and growing and growing, and it's really hard work when you're on your own and you're just working your way through the list. But knowing you've got somebody else doing it with you is lovely, because you do feel like you're sharing it. And as Sandy said, ensuring that people, that advanced nurses doing this, that have got the capability to do it, because obviously you've got the risks of that remote consultation, and these people could have a whole range of presentations. And some could be pretty poorly. So you need to be on the top of your game, really, to be managing that well. One of the strangest questions I was asked was on an on-call session once, where a patient rang up and said they wanted some advice, and they got put on the on-call list. And the question was around the fact that they'd had a power cut and their freezer had defrosted during the power cut, and was it safe to eat the food that was in the freezer? And it was a question that I wasn't really expecting. And, obviously sort of a bit outside of our area of expertise, really, more of a public health question. But yeah, you never know what you're going to be asked or what's coming in through the door next to you. So can be amusing.
So it's just working together as a team and supporting each other. Can be quite a tiring and challenging on call, but equally it just helps as well because you're working together. It sort of brings that team feel together and just makes us feel part of something and sort of working collaboratively really.
Actually, understanding how we can all work together to support each other is really key in that.
One of the things I really like about general practice is that you can make changes quickly. So in hospital settings, it's a bigger ship or vehicle to move. If you see a gap or an issue, it can take quite some time to make those necessary changes. General practice, we're a smaller group, a smaller body. If we see there's a need there, we need some extra support or help, we can hopefully very quickly just turn things around and bring people in to sort of meet those needs.
I've just remembered something, Sandy. Do you remember when we did the I don't know what we called it. We did a sort of scenario type thing. I think we decided. We wanted to try and work out whether we would respond to an emergency situation in a good way. So we thought we'd try it out. So we had a couple of people down. We had one guy collapsed downstairs in reception, but then we had another thing going on upstairs. And I remember you coming out of your room wondering what the hell was going on. Because
you weren't warned that this was going to happen, or did we know that this was going to happen?
You knew that there was something that was going to happen, and it was made very clear that this, you don't need to call an ambulance. This is a scenario. Get on with it. Normally,
you have a kind of a dull, boring talk on managing medical emergencies. But having you sort of coming in and sort of suggesting that as an idea was just a much better way and a much more sort of interesting way of getting the same message across as to how you deal with a collapsed patient. So I do remember that and the kind of panic that you have when you're faced with somebody, and I remember how realistic it all felt.
So I had one gentleman collapse in reception with blood capsules. We had blood coming out of his mouth, and a couple of times I can remember people looking at me going, "This isn't real, is it?" Because they was all feeling a bit unreal, I think. So it was funny. And I think it did make us look at our emergency equipment. We realised that when you put the curtains around somebody, they didn't start until a couple of feet off the floor. So you could still see everything that was going on. Everybody ran upstairs because the panic button had been pushed but didn't take any equipment. So it just sort of made us really think all those things through. But it was a really nice thing that involved all of the team because reception were involved. It was fun. I think we might have to do that again.
Well, just forewarn me so that I'm prepared next time. I've known you for a long time now. It's having that trust in your colleague. I know Julia. I know the clinical work she does. I know I can trust her with patients and with patients with a variety of different problems. I sort of have trust in the clinical judgment. I know that when she's not sure, she will come and ask. I respect the fact that she's very organised, very structured in how she approaches things. Organisationally, if there's a task or an area that needs to be looked at in a practice and Julia's on the case, I know that it's going to be dealt with properly. I think there's a lot of mutual respect there, not just from a professional, but from a personal perspective as well.
Yeah, I agree, and I think that's so important. And when you feel that you have that, and you have that support, you don't, you feel that you can go and talk about things very freely, and it's a really nice environment to work in that situation.
You know that if you've got a clinical problem and you're not quite sure what to do, you can knock on my door. I'm not going to snap or be irritable or whatever. I'll try and do my best to help. And I know that when you do come and see me with a problem, it's going to be something that's, a bit challenging, because you wouldn't do that. You'd normally manage most things. So it is going to be something that is going to be a challenge and a bit interesting. And certainly, yeah, if you're asking for help, I'm going to do what I can to be there.